Many parents are concerned about what school will look like if students go back to class this fall.
And joining us now to talk about how families can stay safe is Dr. Jay Bott. He's a primary care physician who has guided health initiatives for the state. Thank you, Dr. Bott, for joining us. First of all, what are your thoughts on face-to-face in-person learning right now?
Well, good evening. Thanks so much for having me on the call to talk about this really important topic. Look, we'll say that a safe classroom is a healthy classroom. This means the health for all involved: staff, teachers, students, and their families. This is all local. First, you need to have a decline in rates in the community. Every family will need to look at risk and reward and level of community transmission. So face-to-face can work in some circumstances given that there's agreement on safety measures, masks, distancing, and organizing what the classroom looks like to mitigate spread and keep people safe.
Doctor, the CDC put out a statement last week saying the social, emotional, and behavioral health, to say nothing about the economic well-being for children out of school, is more dangerous than to have them in class. What do you think?
Well, I think the health risks of not reopening are real, including mental health, child abuse screening, nutrition, being socially engaged and developing. But I don't think it's all created equal. Those that are maybe further along in their education might require different things, as those that might be younger and need more development. And then we got to think about the unique needs of our most vulnerable populations and what they might need when it comes from technology to being in school. And then you got to have the families involved to take care of them. If someone gets sick, you got to have a plan to know what to do. If you don't have a parent to come pick you up or daycare, that's a real problem.
So, Doctor, let me make sure I'm hearing you correctly. You think it should be case by case?
No, I think that you got to think about the cohort approach, and I think that early on we got to look at all the factors, and then you have to make a determination because this is local.
But we are early on now. We are early. Right. I mean, we're getting late actually because it's a month away for some schools. So what do you suggest? You know, it's kind of confusing. I think as a mother who have kids in school, it's very confusing.
I agree. I think we need to be clear about what capabilities are there. We need testing, we need tracing, we need isolation, you need a disinfectant cleaning process, and you need to organize the classroom in a way that's safe. And we got to reinforce to parents what needs to be done and what the communication is if their kids get sick. So the problem is that we don't know what transmission will be like in the community in September.
Right.
So we've got to be able to think about and have contingencies for if transmission does rise versus being where it is today.
The schools will have safety protocols, but what about outside of the classroom? What's your advice to parents who, of course, don't want their kids to contract the virus and then bring it into school?
Yeah, I think this is really important. You know, a recent Kaiser Family Foundation study said that 3.3 million older adults live with school-going children. Now, that puts them at risk as well. I think we've got to continue to engage in the prevention measures that we've been talking about: wearing the mask, hand hygiene, and distancing. And then also making sure that if you've been exposed to someone that might have COVID or you're having symptoms, at that moment, you've got to be able to speak up and act on that so that others don't get sick.
Dr. Jay Bott, thanks so much for your time tonight.
Thank you so much for having me.